Over the past decade, childhood cases of type 2 diabetes have increased tenfold because of rising rates of obesity. Commonly called adult-onset diabetes, children as young as 8 years old are being diagnosed with the disease. The consequences of this devastating illness could lead to an early grave for many of its victims. Our children are literally eating themselves to death.
We're killing our kids because we're feeding them food that they shouldn't be eating and encouraging them to be sedentary. And the two combined are a time bomb.
If we don't get a handle on this, what's going to happen is that we're going to get kids developing illnesses at a very early age. And some of these illnesses can actually kill them.
Illnesses like type 2 diabetes, heart disease, asthma, high cholesterol, hypertension, and bone and joint problems.
Their joints cannot carry their weight. The number of children that we're seeing with not just overweight, but morbid obesity is increasing. In fact, we had to purchase 2 scales to weigh children greater than 350 pounds.
Your input on obesity in children?
I think that the initiative from First Lady Sarah Michelle Obama was profound in raising a level of consciousness regarding children and obesity. I think the school has responded to that in a very good way in terms of what we offer our students to eat for lunch. However, someone said many moons ago it takes about 21 days for something to become a habit. So our students have developed habits of not making the best choices for foods. So they eat a lot of foods highly concentrated in carbohydrates.
What are some external factors you feel play a role in obesity in children?
I think society as a whole contributes to that. When you look at the offerings, when you go through fast food restaurants, when you look at business. I also think that in schools such as family water, that's not taught anymore. That's not a focus of the education and the curriculum that they receive. And I think that's not helpful for them. And I think that's why we have so many obese people, children and obese people. URS, we don't have a department that talks about food, like a culinary arts department where they really learn the choices that you should make, that you should eat vegetables every day, fruit, drink 8 glasses.
Okay, my name is Audrey Franklin. I'm a food service manager here at Family DRS. I've been here for 4.5 years.
What is your opinion? Like, how do you view childhood obesity?
I think it's a serious problem in our country. And not only in our country, in our schools and in our homes. I think it's very important that we are targeting, healthy kids, especially in the school environment, because parents, for so long, and especially in the generation now, we're all in this kind of do fast, got to do it now type of mindset. So a lot of parents don't have the time or don't maybe feel like going home cooking up from scratch meal. I grew up with that. So that's really all I know, and I brought up my kids that way. And even my kids now, they're young adults, and they're very health conscious about, what they eat, where they go to eat, and these type of things. So I think it's a very serious problem, and it's something that really needs to have a lot of attention given to it.
As a manager, do you plan the lunch menu?
I do, and I plan the lunch menus according to the guidelines of the USDA, which is Food, Nutrition, and Wellness here with the state of Florida. And our guidelines are real stringent right now with the First Lady, Miss Obama, who kind of started this. And her whole insight wasn't really to restrict the foods, but it was just to get the kids active, get them more involved in outdoor activities, exercise more. That's what she basically wanted. Not to be so much as kids sitting home doing just computers, but getting out and exercising and being involved. So yes, I do. I have to literally look at the food item itself. I have to look at all the nutritional facts that goes with calories, salt intake, sodium, the fats, everything. And it has to be, and we're a blended school. We're K through 12. So I have to break down each one by the grades. So, you know, we have K through 5, we have 6 through 8, and then 9 through 12. So I'm dealing with all types of menus and all types of calories and all types of servings that I have to make sure that are on the menus and these kids are getting on a daily basis.
If you could, would you change anything about the guidelines?
Yes. All of it. No. I would make it so tedious the way that they have it, because they're basically telling us they can't have sugar, they can't have salt, they can't have fat. And if you all are pharmacy students, well, you should know that we got to have a certain amount of salt in our bodies. We got to. Can't live without that. I would want to change the way that they guide us in certain amounts of sodium and maybe even sugar that we'll allow them to put in when we do our menu plan, that it would not be such a high restriction, maybe in moderations, and that way the kids would enjoy the meals more, because the kids are not eating. We have to be very creative when we're doing our meal plans. And I'm happy to say that Family DRS, we are very creative. Believe it or not, when we first started, when the guidelines was issued to us, starting in 2009, 2008, I had to become real creative, and I had to think about our culture, because the school here is a predominant black school, so it's a little bit more harder to deal with. You can't feed healthy. They're not going to eat salads, and they're not going to eat vegetables, and they may eat occasionally fruit. But they want the meat and they want the starch, because that's what they're used to at home. So I had to become very creative and implementing and not only educating them during meal times, even online. I communicate with the parents on open house and whatever to get them ready for the change, but also try to keep the traditional meals that the kids are used to, and just be creative with the flavoring, how do we, put the seasoning in, and using a lot of vegetables like, bell peppers and onions and things like that, so that they can still have that little flavor of sweet and sour, salty, and bitter.
If we can get students to develop healthier eating habits and exercise more in and out of school, they will begin to live longer and healthier lives. We can do this by starting them to develop a calorie journal and nutritional focus classes.
With regular, healthy eating habits and frequent exercise, the prevalence of obesity in adolescents will decline and will be one step closer to a whole, healthy population.